So this was a really chronic situation that we inherited. And in some cases, some of the important medicines, like for TB, HIV patients, some of these things were at zero. In terms of a lot of our chronic disease patients, in terms of diabetes, hypertension, cardiovascular diseases, many of these medicines were almost at zero. To sustain the operations at, say, our theaters, many of the drugs that we need to use in the theaters were not available. Anesthetics for dental services, again, these were a problem. HIV test kits. Many of these kits we were low in supply. Chemistry reagents for laboratories, these things were not available. And therefore, it put us in a very challenging situation. Between March and September of 2020, the MMU had these challenges also with PPEs. And you would recall many of the nurses and other frontline healthcare workers were asking us for PPEs because they were not getting enough. At the present time, what have we done to stabilize the situation? We have been working very hard to procure things into the system. And so last year, we did an emergency procurement, and we have expended close to $12 billion to ensure that we get supplies into the system. Of this $12 billion, we spent $4 billion on essential medicines, just to bring in medicines that are urgently needed. And we spent another $5 billion acquiring PPEs. And we spent $3 billion just to buy reagents so our laboratories can function properly. And with this, we have been able now, when someone sent in a crib from the region, to at least be able to meet about 64 to, and in some cases, depending on what they're asking for, to maybe 100% of their needs.